Hello, I'm Emma Green, the Tennis Elbow Queen, and in this video I am going to give you a few pointers on how to choose a therapist or an expert who is going to help you with your tennis elbow. Not that many years ago, choice was really limited. You basically went to see your general practitioner or your primary care physician, and they would likely refer you to a local therapist. And it was kind of luck of the draw. It was the roll of the dice as to whether that person was experienced in helping tennis elbow patients or whether it wasn't really something that they saw an awful lot of. And what we know from the research is that most general therapists don't really see a lot of tennis elbows, and that's because the research shows us 1 to 3% of the general population are going to suffer with tennis elbow at any point in their lives. Now, if the clinic was close to a tennis club or associated with a tennis club, that definitely is higher. Up to 50% of tennis players are going to experience elbow pain at some point in their playing career. It was really down to luck as to where your doctor would send you, where your insurance would cover you to go, and hope for the best and hope that it worked. And for about 50% of people it worked, and for 50% of people it didn't. Fast forward to today, and there is so much more access to information. I mean, you can Google how to heal your tennis elbow. You can ask ChatGPT how to heal your tennis elbow, and you're gonna get a whole load of information right at your fingertips, things that we never had access to before. When you've got information, you can make an informed decision. And so with that information, you can then decide, okay, what is going to be the best course of action for me? Who do I need to see to help me? Or can I do it myself? Can I just follow these exercises that I found on YouTube or on Google or what ChatGPT has told me to do? Try it and see. Now, there are some caveats to that. Some of the information out there is, I was going to say not good. I was going to say not helpful, but actually I'm going to say downright detrimental. There are some practices of tennis elbow that we know are detrimental to the tendon and not helpful at all. I'm talking about steroid injections. This used to be a very common treatment practice back in the day. Steroid injections were commonly used, and that is because steroid is a very strong anti-inflammatory, and so the thinking behind it was, that this is an inflammatory condition, let's reduce the inflammation, and that's going to help the tendon to heal. We know now with more recent research that once you've had elbow pain for a few weeks, a few months, it's not an inflammatory condition anymore. Even though it's still hurting, and yes, it's still hurting, it's more of an irritation, it's a degeneration of the tendon which causes this irritation and the symptoms, the pain, not inflammation. And so that thinking of, well, let's give it a very strong anti-inflammatory to reduce it, that isn't necessarily the right way of thinking when we're thinking specifically of tennis elbow. The other thing that we know, and again, research has shown that steroid is detrimental to the tendon. It can break down soft tissues like tendon. That's not a good situation. So ideally, we want to stay away from injections, particularly steroid injections. There are other types of injections. There's PRP, there's stem cells, enzymes, vitamins, all kinds of different things are being tested and trialed. And the reason they're being tested and trialed is because tennis elbow can be pretty stubborn to get rid of. And so there isn't a gold standard of treatment. If you look at some other conditions, if you look at, say, an ACL reconstruction in the knee, or you look at a sprained ankle, there are pretty clear protocols for rehabbing those types of injuries. The research all agrees on what works, what doesn't work, the best course of action. That isn't necessarily the case for tennis elbow. And it always used to surprise me initially when I first started my journey with tennis elbow. It's a simple thing, it's a tiny little tendon, it's simple. That's where our thinking breaks down, because it's actually quite a complex issue. Once you've had this for longer than 3 months, generally other tissues are involved, and generally the nervous system is involved, nerves are involved, and we have to address those. So it can become more complex, and if those things are not addressed, then the tendon can't heal. Basically, the body stops itself from healing. That's the reason that it's not so cut and dried. It's not like, oh, follow these steps, you're gonna get better. Now, if you've had elbow pain for a very short amount of time, follow the steps, try them, try these things. Try non-invasive things. Don't go and jump for an injection. It's not the best course of treatment. The research shows us that. But try the other things. Anything that is non-invasive, try it. See if it works for you. If it does, brilliant. Get going, keep going with it. If it doesn't, just know there are other things that you can do. We know that we need to utilize eccentric loading to heal the tendon. We know that we need to bring muscle tension down. There are certain steps that you need to do to prepare the tissues to allow them to tolerate the eccentric loading that you need. And that eccentric loading needs to get heavy. If you're working with a 2-pound weight, a 3-pound weight, say a kilo or a kilo and a half, that's not heavy enough to get you back playing tennis. It's not heavy enough to get you back playing golf. It's not heavy enough for you to become pain-free. So know that the rehab is extensive, and that's just because tendons take a long time to heal. It's the way they're made. The research shows us this. So it's extensive. We're talking 12 months of doing these exercises. We're not talking 12 months of having pain. Pain we can get rid of very quickly, but to rehab the tendon, you do need to be doing the exercises for that length of time. If you stop too soon, then you don't get the full healing and it can recur. So ensure that you are rehabbing for long enough, ensure that you are getting heavy enough when you're doing the eccentric loading. You have so much information at your fingertips now, so much information in your pocket. We've got more computer power in our pocket now than they had landing men on the moon. I mean, it's just crazy the amount of power that we have. So do your research, do your due diligence, do your research, reach out to people who are talking about these things a lot. There are a number of us out there talking about these things. Talk to somebody who's experienced in this particular problem. That's what you want. You want an expert who is going to help you with this. So if you have any questions, don't hesitate to reach out. If this has been helpful, please like this video. I'd love for you to subscribe to my channel to get more information, hints and tips like this. And if you know somebody who would benefit from this, please forward it on. Hope to see you in the next video. Take care. Bye.